joining us? Okay, Puan Ruzina, if it's possible, do try and adjust your audio settings a little bit more so we can hear you clearer. For the participants, if you can hear, do let us know in chat whether you can or cannot hear.
Hello, can you hear me?
Hello?
Hello, can you hear me?
Yes, I can hear you. What about everyone else? Kenna? Thank you very much, Shalini, Olivia, and Dominic. Okay, I'm going to start playing our start reel for today. And yep, we will begin shortly. Can you guys hear the audio? Thank you so much, everyone. Thank you, Raysonic, for the sound check. I would like to invite our panelists today to do a quick sound test before we begin. Puan Ruzina. Puan Ruzina, are you there? Yeah, I think the participants are muted. Let me try and ask them to unmute.
Hello.
Hi, thank you very
Hi.
much. Okay, I have to make sure that our other guest speaker is here. I think they were in for a little while and then they disconnected. Give me 1 second, yeah? How is everyone doing? Good, good. From Koi, from Dominic, all good. I'm trying to get our other guest speaker in. Okay, there we go. Thank you so much for joining us here today, Dr. Kong. Okay, without further ado, we will start today's webinar. If our panelists can turn on the webcam, will be very helpful so that our participants can see who they're talking to today. Okay, thank you guys so much for coming. Hi, Dr. Kong.
My video.
Okay. Hello, everyone, participants. Thank you so much for coming here today. We have 31 attendees right now. Welcome, everyone. Today's webinar is going to be about wheelchairs and how to choose the right wheelchair, as well as which wheelchair fits what type of patient. So for caregivers, for those who are taking care of their parents at home, or those who are looking for or have bought a wheelchair that doesn't quite fit the loved one, today we have Puan Ruzina Baharuddin from the Occupational Therapist Association of Malaysia, otherwise known as MOTA, M-O-T-A. She's also the head of Wheelchair and Rehabilitation Department from UMMC. Here today with us to coach us. And we also have Dr. Kong Wai Hong, founder of AIM Healthcare and iElder.Asia, to tell us a little bit more about his perspective as a medical practitioner. I do see a Miss Mary raising her hand. Yes, Miss Mary, if you have any questions, you can type it out in the chat. And when the opportunity arises, I will address these questions to our panelists.
We are disabled.
Sorry?
Hello. I can't on my video because it was disabled.
Okay, let me take a look really quickly.
The host has disabled it. Yeah.
Oh, that's strange. Just give me one
Same
second.
as me.
Okay, understand. No problem. Just give me a moment, yeah? Yes, Miss Kaylee. I see a few people raising their hands. Just give me a moment to enable the videos for our panelists here. Okay, Puan Ruzina and Dr. Kong, you can try now. Sorry, Zoom settings are quite complicated. Okay, thank you very much, Dr. Kong. We can see you now.
All right. You see
Hello,
me?
Puan Ruzina. Okay,
Hi.
without further ado, I would like to invite maybe Dr. Kong and Puan Ruzina to do a short self-introduction before we begin. Starting with maybe Dr. Kong.
Hi. Good afternoon to everyone. Can you hear me?
Yes.
Yeah, is the voice clear?
Yes, it's fine on our end.
Okay. So, Eugene, can I start? Or
Yeah. A short introduction about yourself, Dr. Kong.
Okay. Good afternoon to everyone. Puan Ruzina and all the guests. So, my name is Dr. Kong Wai Hong, founder of the AIM Healthcare and the managing director of iElder.Asia. So the AIM in AIM Healthcare stand for Asian Integrated Medical. So I started this company to bring the light to the integrative medicine. So which can be simply explained as the best practices of Western and Chinese traditional medicine put together. So to achieve the best available treatment for the patient. But most Western medicine and traditional Chinese medicine practitioners just choose one side normally and don't speak to each other. Another actually, so there are two sides of the same coin. In my clinic at the Cheras Perdana, I treat patients using knowledge of both medicine practice.
Okay. Thank you very much, Dr. Kong. Dr. Kong is the founder of AIM Healthcare and iElder.Asia, which is the host for today's webinar. Next, maybe Puan Ruzina, you can tell us a little bit about yourself. Puan Ruzina, you are muted.
Okay. Hi,
Okay.
everyone. Sorry for that. I'm not so familiar with this IT. Anyway, I'm Ruzina Baharuddin. Actually, I've been involved in this wheelchair, not to say that long, I think about 10 years, but I've been working in PPOM for about 31 years. So getting involved more in wheelchair, since that we need to develop wheelchair more to give an awareness to our public about the importance of wheelchair. So at the same time, I'm also a president of MOTA. Hopefully that this presentation will give a little bit of information and also knowledge to all of us, so that we know that how important the wheelchair to our patient and our community. Yes, thank you.
Thank you very much, Puan Ruzina. Okay, so before we begin, we wanted to host this webinar here today because we have a lot of customers and we've heard a lot of stories about people coming in to get wheelchairs, but most people, they have no idea what their loved ones need or what kind of wheelchair they need to get. Some of them in their rush or in their hurry or anxiety, whenever their loved ones encounter an accident or suddenly need a wheelchair, they just immediately go and get whatever's available. And then when it comes down to it, when they need certain things or certain features of a wheelchair, they would have found out that they got the wrong one. In other situations, we have certain caretakers as well who might be new to the industry. They don't really know which wheelchair fits what patient, and then they encounter different kinds of problems. So today's webinar is open for both caretakers and our family members alike who want to take care of their loved ones or to just gain a little bit of knowledge about what wheelchairs can do for you, that the different types of wheelchairs can do for you. Right. So let's begin by inviting Dr. Kong to talk about wheelchairs from a very medical perspective. Dr. Kong, you mentioned that you practice integrative medicine, right? You want to bring the best of the Western medicine and traditional Chinese medicine to light. So Dr. Kong, based on your knowledge and experience in the field of integrative medicine, how does being wheelchair bound affect a person, from a holistic point of view?
Okay, first of all, actually it's a very inconvenient. Most furniture and the public utilities are designed for the average adult. So, and there are very few spaces designed with a special utility for the people who need the wheelchair. Yeah. So secondly, patients, they have problem moving around and make them more vulnerable to the accident and other medical condition. So the seated posture basically compress all the internal structure, especially the buttock area, gluteus area. So which can cause pressure ulcer or injury, a bowel and bladder problem, and even breathing difficulty as well. Yeah? Poor circulation and muscle tightness when seated for a prolonged period of time. So 5 of the most common health conditions faced by the wheelchair users normally, like first, weight gain. Yeah, I think weight gain is the most common problem for the wheelchair user. So although many manual wheelchair users gain upper body strength, because of they use their both arms to move the wheelchair. Other wheelchair users become more sedentary because of the nature of their injury. If you have a spinal cord injury, so it's likely that the muscle mass below your injury has decreased and the fat has increased. yeah, especially the both limbs, yeah, both limb muscles, dystrophy, and all the fat has increased at the buttock area. And your metabolism has slowed down and it's much easier to put on weight. So weight gain, however, can make it harder to move and increase the joint pain as well and likelihood of developing pressure sore. So the second, diabetes. I think in Malaysia, this is a very high rate incident in Malaysia. If you put on weight and become obese, your likelihood of developing diabetes rise dramatically. So this is partly because of the way of the body processes insulin has changed. Of course, include our diet habit. Malaysia is very good. Is a heaven of food. Yeah. So your injury might mask some of the symptoms, such as increased thirst and exertion of the urination. Uh, and also because most of the wheelchair user, they might use diapers, yeah, and all this excessive urination will cause many problems as well. And third, the bone and the joint pain. Manual wheelchair users are susceptible to the shoulder pain. Why? Because they use maybe the size and the height of the wheelchair is in the wrong height, yeah, and the rotator cuff injury and stress on their extremities. So muscle tightness can develop in front of the shoulders, and opposing muscles can become longer and weaker. So many wheelchair user may complain the shoulder pain, the elbow pain, or even the wrist pain. Yeah. Fourth, the pressure ulcer. Yeah, pressure sore. So loss of the muscle tone and diminished the circulation can cause pressure sores to develop. So especially your skin regularly to spot any developing sores and treat them quickly and daily until they are gone. So I think pressure sore is not only normally patient sit on wheelchair is not for long period. I think the pressure sore is normally is for those who bed bound on the bed for long period. Yeah, but however, for those especially some centers, because we encourage them to sit not only lying flat. Yeah, so when somebody put them on the wheelchair, then they just put there and then until few hours without moving their body posture. This will eventually will cause pressure sore. And some more, there are many patients because due to the lack of nutrients, yeah, or the muscle dystrophy, skin, especially for those diabetic patients, the skin also easily be injured, not healthy. And the third and the fifth, the heart disease. Wheelchair user who are overweight and also increase the risk of developing the heart problems. Yeah. So I think basically this is all problems. Yeah. Normally the wheelchair user they are facing. Yeah. Eugene.
Thank you very much, Dr. Kong. So the audience, if you have any questions for Dr. Kong regarding this complications that you might have faced for your patients that that are used wheelchairs, you can go ahead and ask for his advice. But my question to you, Dr. Kong, is you've mentioned all these complications that the wheelchair users will face. So is there any advice you can give for these patients to sort of prevent all of these complications?
I think the two most important things is to take care of the diet and the exercise. Basically, those who really wheelchair user, of course, they have many underlying disease. Yeah, I think even the psychologically they are depressed. So I think basically the diet and the exercise, and also they need to be more careful. Of course, say is easier than doing. So the most important, I think the family members need to give a fully support, yeah, to encourage them to be healthier. So make sure to careful about what you eat and drink enough water daily. Yeah. Normally, wheelchair user, they depends on somebody to bring the food or the water, maybe, yeah. So that's why the lack of water, and because so drinking water is very important for the healthy skin and the muscle. Yeah. So for exercise, the important to stress your joint and muscle to maintain the muscle strength and to relieve the stress from the body. Yeah. Yes, the wheelchair user, you are not, yes, maybe they can't move their lower limb, but the buttock side and the waist side, they still can move. So I think we normally we encourage them to do some exercise, to prevent the certain area to be pressed on for long period, to make sure to keep the proper sitting posture, and maybe can buy some air cushion for your wheelchair to avoid the pressure fall. Of course, for integrative medicine, I think basically integrative medicine, that is Western and combined with all the complementary medicine. From my side is the Chinese herbal. So from the Chinese herbal, of course, the most important the aim is to treat the underlying and to improve the quality of life, to improve their nutrients. Yeah? From the herbal medicine, we try to regulate their body in order they can reduce all the side effects of the medication, and some massage. Yeah, massage also is very good to improve the muscle tone and to improve all the strength of the ligaments and all the joint. Yeah. So basically the trainer and massage, but of course this uh, can be done by the wheelchair user himself or by somebody else. Yeah. So that's why they may have they can use their both hands or upper limb to do some massage or some light punch, some lifting the lower limbs, uh, and of course like cupping, all this. Yes, they can do. And also acupuncture treatment. All this is actually is to aim to build up their muscle strength, to build up the nerve, yeah, activation of the nerve, in order the blood circulation can be improved. So to reduce all these complications by using wheelchair. That's all. Thank you.
Thank you, Dr. Kong. One last question for today. You mentioned that this more towards the TCM side, like Tuina, like this herbal medicine, is meant to strengthen the muscle mass. Whereas I think Western medicine would recommend something more like physiotherapy, right? So when it comes to integrative medicine, what would you say would be a well-balanced way to go about it? Like, let's say if there's a wheelchair user that's going through physiotherapy, what should they seek, or what should they get to make it the wholesome type of treatment, rather than just getting physiotherapy? What else do they need to get the wholesome treatment?
Of course, there are many scenarios, because for the wheelchair user, there are many scenarios. Mostly it's a stroke patient or some spine injury or some others because of bone fractures. So basically, physiotherapy is to try to improve or to cure the main problem. Yeah, to improve, in order them can not really depends on the wheelchair. They can sit, they can stand up, just throw away the wheelchair. That is their aim. So basically, acupuncture or others, massage or chiropractors or all this. The aim also is to improve their own main problem, like spine problem or the stroke problem, in order them to not really just depend on the wheelchair. Of course, I think later Puan Ruzina can talk more about this, all the what is the proper way by using of this. So our, as a doctors or as a alternative practitioner, our aim is to in order them to recover from their own condition.
I see.
Okay.
Yep. Thank you very much, Dr. Kong, for the insight. For those of you in the audience who might have more questions for Dr. Kong, you can go and visit us on Facebook and drop a comment, maybe on the webinar post itself, that you can look us up on the facebook.com/iElder.Asia. Yeah. There'll be a link to it. You can look us up on Instagram as well. You can just drop us a comment anywhere or just call in, visit our website, iElder.Asia, and go to the contact us page. You can give us a call or visit Dr. Kong, arrange an appointment at Polyclinic Perdana in Cheras Perdana. Okay, so thank you very much, Dr. Kong, for your insight. Next up, we will have Puan Ruzina Baharuddin. Again, she is the president of MOTA and also the head of the wheelchair and rehab department in UMMC. In fact, today, for those who stay until the end of the webinar, you will receive a free ebook courtesy of UMMC. So thank you very much for that, Puan Ruzina. For those of you who stay until the end as well, you will be automatically put into a raffle to win one of 16 boxes of Mase Quick Touch hair color. So do stay until the end of the webinar to stand a chance to win. Yeah, that one is courtesy of iElder.Asia. Okay. Without further ado, I'd like to invite Puan Ruzina Baharuddin to give us a presentation on how we can choose and select the proper wheelchair for our loved ones. Puan Ruzina, the floor is yours.
Yes, thank you very much. Thank you, Dr. Kong. I want to share my slide first. All right, can you all see? Oh, is it okay?
Looks great.
All right. Okay. Good afternoon again to all of you. It's just I would like to know everybody joining us today. Are they from a hospital or from any center or individual, or is it any of you can just give me an idea? Okay. Okay. All right. So okay. All right, our topic today is very simple, how to choose a wheelchair, which is to me, everybody, they know how to choose a wheelchair. So before we proceed with that, it's just that I would like to emphasize that wheelchair is not as simple as we thought. So it is something that unique to think of. Okay, next slide will be, sorry, how do I go to the next slide? Uh-oh, hold on. All right. Okay, as we know that, everybody knows that wheelchair is one of commonly assistive device being used in our mobility. So this is very widely used in all over the world. So it's just that the difference is the types, the device, the wheelchair could be a simple wheelchair, could be complicated, could be very high-tech. So this is some of choosing a wheelchair is some of us maybe conflict or maybe confused about it. All right, before we go on with choosing the wheelchair, we should understand that United Nations Convention, United Nations, the right of person with disability, has in his article in 20 has mentioned that United Nations Convention on the Right of Person with Disability advocates for effective measures to ensure that personal mobility with greatest possible independence for person with disability. So we should provide people with personal mobility with what I call this affordable, and they're able to choose their wheelchair, affordable cost, I mean. And then these people also need to have a quality mobility aids device, and then assistive technologies, and then providing them a training in mobility skills to people with disability. So this is some of United Nations has mentioned in their convention. All right, what exactly you want to know about the wheelchair before we proceed, or we think of what wheelchair suit to our care, to our patient, or to our father, mother, or our child, whoever, or our elderly, or whoever. This is some of the things that we need to understand first. Who is our wheelchair user? We have to identify who is our wheelchair user. So people who already have a wheelchair, or maybe people who not yet have any wheelchair. So from what we can see, whether it's benefit or not, what we choose. So you know that our user will be our children, could be our father or mother, could be our grandfather or grandchild, or anybody. All right. So people with different mobility impairment, also you have to look at their lifestyle. Are they active? Are they passive? Or are they going out once in a while? Or how far do they go? All right. What is their role? Are they a manager? Are they athlete? Or are they just being a housewife at home? So this is all the background or roles that we need to assess. We need to look before we choose. All right. We cannot say that once they are disabled, they are not going to back to work, or they are not going to be on their own role as a mother, as a manager, or as whatever they do before. Okay. Another thing is we have to look at the people living and working in different environment, whether they are in the rural area, semi-urban, or urban area. Why we think about this? Because this is where you know that the accessibility will be different from rural, from urban, and from semi-urban. So we have to choose a wheelchair that really fits to our user. So as mentioned by Dr. Kong just now, there are benefits that we can gain from using the wheelchair. Of course, the first one will be mobility, right? We try to help people to get around with the greatest possible independence and do the things what they want. So by providing the wheelchair, we hope that wheelchair user will able to choose, will be able to go around, mix with the community, and do what they want to do. And there's no limitation. Okay, and the next will be it's their health. Okay, we once they are not on the bed bound, we try to seat the patient on the wheelchair. At the same time, we will improve their health. All right, with the well-fitting wheelchair, and we cannot forget that every wheelchair need to be provided with cushion. So because as mentioned at Dr. Kong, that many patients having a problems sitting on a wheelchair, complaining of pain at the buttocks, pain somewhere at the back. So if we imagine that when we sit on the chair, even though it's not a wheelchair, but on the chair, how long do you think that we can sit? We can only sit static, I think about 15 minutes to 20 minutes, and then we feel like we need to move around. And if this chair is not comfortable, you might feel that you are starting moving around. So same goes with this wheelchair. When they are wheelchair bound, we need to provide comfortable sitting so that they can they can sit longer than 20 minutes. All right. So next will be the independence. So once they are on the wheelchair, they are independent. They can move around. They know what they want to do. So even though they are a caregiver, have to push for them, but still they can express what they want. They can go more besides in the house or besides in the room. So they can go out from that environment to another environment. And at the same time, once they are on the wheelchair, they are more confident, and this will increase their self-esteem. They will feel more better, which is this is will influence their psychological effect. So that's why there are a lot of benefits when you put the patient on the wheelchair, where they can look around and they can talk, they can communicate with people, they can communicate with their children or community or their friends or their neighbors. And lastly will be the access to community life. As I mentioned just now, this is also, they can talk and mix around with people. All right, once we have know the benefit of what's the wheelchair, why we need a wheelchair, we also have to work together with people who are expert to choose a more suitable wheelchair amongst them. Sometimes caregiver and patients, I know they can express what they want, they can express their problem and their needs, but sometimes they could not relate with the wheelchair, types of wheelchair that really can suit with what they need. That's why it's good to work together with a wheelchair service team, either whoever who are able to provide that. All right, this is 8 step. If possible, any of us could provide. Doesn't matter whether from UMMC or from any centers or from any suppliers. That is good that before we start anything, you should have appointment because once you got appointment, and you, of course, referral is good to have if you can, but in our UMMC, of course, we need a referral from our doctors, and we fix an appointment. Because when we fix an appointment, any of us, you can set a proper assessment later on. Instead of just show them on the shelf, this wheelchair and that wheelchair, but you did not know the background of the patient or the client. So that's why an assessment is very important. So looking at the assessment, there are a few things that we all need to know about the assessment. Of course, the patient's background, medical background, and then we want to know previously, are they wheelchair user before, or this is the first time? Do they have any injury, bit sore injury, or do they would like to be active outside, outdoor? So all these assessments need to be in our list. And besides measuring the weight, without measuring, besides measuring the depth, the length of the foot, the backrest, where the backrest, we have to identify, we have to make sure that whether the backrest need to be support above the elbow or above the shoulder or maybe at the head. This is all assessment that we need to go through so that we could prescribe the right wheelchair for our clients or for our patients. All right, after we have assessed everything, we need to prescribe. Then only we will tell the patients the option that we have. Either patients need a wheelchair with head support, wheelchair, active wheelchair, which the backrest should be below our shoulder, where the patients could move more compared to the wheelchair that at the shoulder level. So this choice, this prescription has to refers again to the assessment that we did. Otherwise, what we prescribe, that's why it is wrong. Sometimes it's not accurate. Sometimes we feel that, oh, this is not the right what we want. So that's why assessment is very important. All right, after we have prescribed, then of course we have to look for funding and we are start ordering. This kind of funding either can be self-funding, can be from kebajikan, can be any NGOs, can be anywhere. So I'm not so sure iElder whether they are from their funding could be individual or could be from the caretaker. I'm not so sure, but UMMC we do provide funding from other sources like kebajikan, and then like what call this other NGOs. We do contact them and we try to fix per peso or SOCSO, something like that. And once we agree with the prescription and we are clear who is going to give the funding, then we will start ordering the wheelchair. Ordering a wheelchair could be the one that we prescribe, could be similar, could be not similar, because you know why? Our suppliers sometimes, or our people who provide the wheelchair from our company, there are so many people who are selling wheelchairs, include iElder, also selling a wheelchair. But of course, we want to fit with the prescription that we have given to the clients. So for that purpose, we have to analyze, we have to choose which is the best, and we give them the quotation, and they make the decision which wheelchair is fit for them. All right, and for this, once we have ordered and we have received the wheelchair, or maybe the clients have received the wheelchair, they need to check the wheelchair first. Before receiving. To check the wheelchair means is to make sure that the armrest is function detachable, the footrest is good. It can be detached. The caster is good. You can test the caster by just roll the caster down, and it will shows that the movement is smooth. And look at the big wheel, whether the big wheel is good condition, whether the big wheel can be detached or quick release, or once you can do all that, you ensure that everything is good, and you can fold the wheelchair. So all this has to be tested once you receive the wheelchair from the supplier or from anybody, whoever gives the wheelchair. Because we receive a lot of people who have already received the wheelchair, and they was not told how to manage the wheelchair, how to remove the armrest, how to remove the footrest, and also the wheel. So they didn't know how to operate, especially wheelchair, motorized wheelchair. So surprisingly, by right, whoever provided should give a demo to our clients how to manage or how to operate the wheelchair. All right. For the next step is a product wheelchair preparation. Okay, for this one, if let's say the wheelchair that been ordered and been received is slightly bigger or much bigger, or maybe because of a wrong prescription, most probably. So we have to do something about it because it's already purchased. So we are not going to straight away and change the wheelchair because you have bought it and it could be very expensive, but it doesn't fit the width. So what we will do is we need to add some cushion on the left and right so that we support their sitting position, so that they don't have much rooms for them to move left and right or lean to left and right. Because if you give them a lot of space for them to lean left and right, they could develop another issues like back pain, scoliosis, and other than that, it could be problems like uncomfortable during sitting on the wheelchair. So once we have do some modification because of too big or too small, so we have to do a fitting, whether the one that we provide the additional product could fit the patients on the wheelchair. So I think iElder should think of also about this, because we have company from, I can't remember from where, I think from Seremban. They provide the wheelchair, but they know that they couldn't provide the exact wheelchair, but they do a modification from their company side, and they add additional cushion for the patient, so that patient really fit and more comfortable. And also before that, after that, we have to train them. Once they receive the wheelchair, training is very important, either the caretaker or the patients, because sometimes a wheelchair looks so simple, but training it takes some time for patients to get used to it, and also the caretaker. So the caretaker has to know how to push, how to lift the wheelchair, especially in the obstacle area, ramp, stairs, 2 or 3 step stairs. So this is all things that you have to consider in your list, whether to buy what type of wheelchair that you really want. If your environment is more like no obstacle, no stairs, you could be looking for something more simpler, which is easier. Maybe standard wheelchair with detachable armrest could be the best for the patient. All right. And finally, once we have received the wheelchair, all of caretaker and also patients needs to know how do they want to maintain the wheelchair, how do they want to repair the wheelchair, and follow up if it's needed, because maintaining the wheelchair is like taking care of our car. So if you buy a wheelchair, same like cars that you buy BMW cars with a lot of money, can. So same goes with wheelchair. If you can have wheelchair with 10,000, you can have wheelchair with 15,000, 20,000, 50,000, 500, 300. But still, we should take care of the wheelchair like we take care of our car. Should put lubricant, should always wipe the wheelchair at least once a week, so that it doesn't easily rusty. So that the wheel is fully function, and there's no what I call as hair in the between of our casters, they're small casters. So the hair is always trapped in the between of our wheel and front part. So it will stuck inside there, and finally you cannot push. So you thought that is the wheelchair is not functioning, but actually there's a lot of hair inside the wheel. So, and then you have to look at the bearing, whether the bearing is functioning or not. So this is all the maintenance that you need to think of later. If you want to buy something more expensive, let's say you want to buy like, what I call this, motorized wheelchair. All right, we have to think of who is going to back up our wheelchair if we buy this wheelchair. Is the supplier able to supply the backup maintenance? If you can do that, you know that they can, then I think you can proceed with that. So choosing is always look at everything, not just buying and then push and sit. All right. Okay. This is just give you an idea of wheelchair mobility that people need to know. Training in mobility skill is very important. So for first training, somebody has to be there at the back so that they are secured during the training. So training can be in a rough area, sandy, muddy, or something like that. So anybody can do the training, but of course, the helper at the back need to have an experience and also expert. All right, people will need to look at wheelchair that where do you want to push your clients or your patients or your daughter or your father, mother, where do you want to push? Is it somewhere like pushing just up slope, down slope, steps, partial wheelie? If partial wheelie could be the patients wants to, whoever patients like able to have do the partial wheelie. So we have to find a wheelchair that lighter, either semi-light or light, which is easier for them to do the partial wheelie. And then turning down slope, pushing down steps, and also with assistance. All right. Some of our patients might need assistance while they're using the wheelchair. So the caretaker has to know how to lift the wheelchair, how to handle the wheelchair, turn left and right, going down the slope, going up the slope. All right. Okay. If you look at the right side of me, people, my team is actually teaching the patients how to use stairs. All right. This is people who are unable to what I call this. They don't have lift, or they don't have any. They are living in the double story, but patients need to go up instead of downstairs. So this is how we taught them how to lift up, and then how to go up the stairs and go down the stairs. Of course, this will need more training to the patient, and this is very important. Yeah. All right. Sitting upright. Sitting upright is most important during sitting on the wheelchair. That's why sometimes we receive a patients that sitting not upright, where they try to lean and they try to sit in slouching position, and they try to put their head at the handle. So this is sitting position. This is not should happen while sitting on the wheelchair. If it is happened, then something need to be done so that they could sit upright. So most wheelchair user who are spending their time on the wheelchair, they should consider that sitting upright is important, because otherwise they will develop many complications after that. Right. What is posture actually? How people sit on the wheelchair is same how do we sit on the chair. So it should be, the formula is 90, 90, 90, means 90 hips, 90 knee, and 90 at the ankle. That is the standard, what you call this, formula for everybody. So, but we have to think of not all of us able to maintain 90, 90, 90, because so after sometimes we feel that we are so tired sitting upright in that position. That's why wheelchair has to be comfortable with that position. Yeah. All right. Why sitting upright is, ataupun sitting neutral is very important, because again, is to improve the health so that they didn't develop other problem. Yeah. And then the weight during the sitting is distributed equally, and we want to prevent from problems with posture, and also we want to improve their stability, all right, and provide comfort, and also self-confidence, and also self-esteem. All right, just have a look, simple. Have you just look at the spine. If patients ataupun any of our family members sitting in this kind of position, you can look at the spine. How does it look like? So the first one, anterior tilt, where the spine is curved to forward. So this is where it's a very bad posture that we should avoid. And if you look at the second one is tilting. Yeah, this is tilting sideways, and also it's not that good. This is postural tilt. You can have a look that the spine is bending forward, and develop like kyphosis, or you are like membongkok lah, you develop that. And this tends to, your head is looking down, which is what we want is patients when they sit on a wheelchair, they should look straight, so that their communication is their eye contact is direct to the patients, that ataupun direct to the people that they want to talk to. So we should not allow this happen, because I know a lot of geriatric or elder people, they develop this kind of posture, and they always place their head down, looking at down. So whenever you want to talk, they couldn't look at you. There's no eye contact between caretaker and also with the patient. And this is actually a rotation, means you can look at the hips, is one is forward and one is backwards. So this is some of the problems that if we do not really choose, or maybe they already developed this kind of problems before they have their own wheelchair. Yeah. So that's why assessment is very important. All right, we are talking about pressure injury. Just now, Dr. Kong has talked about pressure injury. So we should prevent this pressure injury happen to any of our family members, because once it's developed or once it's happened, it's very difficult for the pressure injury to heal. It takes about a month or maybe 3 months, 6 months, a year for people who are having less sensation or no sensation, especially people with tetraplegic and also paraplegic. So also with geriatric people, because we know that there are lack of nutrition sometimes, yeah. So if you look at this, what causes pressure injury is, one is pressure, second is frictions and shearing. So shearing can develop anytime once patient is sitting on the wheelchair, all right? Especially when they feel that it's uncomfortable, they will try to start slouching themselves. So where there's a shearing there, and they start friction and shearing, all right? All right, how to make sure that this is this is a risk factor that why this pressure injury developed. All right, of course, lost degree sensation, unable to move, moisture from sweat, water, and then incontinence, where this always develop in our elderly people, poor posture, right? And then previous current pressure injury. This is also one of risk factors that pressure injury recurrent. And poor diet, as mentioned as Dr. Kong, when you got poor diet, your skin health is poor, so you develop with dryness of your skin, all right, your muscle are weak, everything, and you did not drink a lot of water. Of course, aging is also one of the risk factor in our elderly, and also our weight, either underweight or overweight. So these two could be risk factor for pressure injury. Okay, let's look at the pressure injury while sitting on the wheelchair. If you look at the sideway, you get 1, 2, 3, 4, 5, 6, 7 pressure that could happen to any of our family members who are sitting on the wheelchair. So we must identify this, so that we should check this pressure so that it doesn't develop, doesn't give any problems. From back view, there's a 1, 2, 3, 4, 5, 6, 7, 8 also can also cause a pressure injury. So this is all things that we need to take care of. Once we try to choose a wheelchair, we already choose a wheelchair, but we need to look all this. Or before we choose a wheelchair, we should make sure that you be able to identify this, whether this will cause pressure later on. Okay, how to prevent this? Okay, of course, you need to use a pressure relief cushion. If our client or if our family members already develop pressure injury, so we need to use a pressure relief cushion. All right, we have many on the shelf, that pressure relief cushions, like air cushion, like foam cushion. We have water cushion. We have what else? we have foam cushion, we have gel cushion. So all this cushion can be used to relieve the pressure. All right, sit upright, as I mentioned just now, 90, 90, 90, and then helps to distribute weight evenly, and then able to reduce shearing. And then again, the same goes, you need to do a pressure relief technique. I'll show you after this, how do we do a pressure relief technique. Eat well and drink lots of water, and then avoid all this friction, moisture, and then we have to daily check our skin. All our family members who are using the wheelchair, we have to check the skin, all right? Is there any redness or is there any developed pressure already? And then regular change position during lying or sitting. Oops. Uh-oh. Why it stopped? Hold on. All right. All right. This is the techniques that we should perform, either independently or with assist. So if you look at first one, this one, if our patients or our family members able to do this, this is good. Just lean forward, yeah, and you will relieve the pressure at the buttock. So this could be performed every 15 to 20 minutes. Or this is impossible because sometimes give you a lot of balance. So patient might feel scared about doing lean forward. You can just lift up your, just lean to left and right, press on the armrest and just lean to one side so that you are giving the relief at the buttocks, left and right. And this is whoever patients that able to reach their hand to the floor also can be performed. Or the easiest will be you just leave the leg, one leg, and then cross the other leg, and then change the other leg, cross another leg. So just relieve about, just count about 1 minute, and then that's it. All right, and then relieve. Some people, they do push up. But push-up is also a technique of relief, pressure relief, but sometimes push-up can cause tired every 15 to 20 minutes, especially at the elbow and also their upper limbs. All right, so I hope that everybody get what I mean. Any question, you can just ask if you want before I proceed the next slide. Anyone have any questions so far?
Okay, since you're opening up the floor to some Q&A, we do have a question from one of our viewers on Facebook. This is from a Mr. Shiva Saragam, who is asking about the part about seat padding. So he wants to know if you can recommend any add-on seat paddings that give the best comfort for wheelchair users. Is there a recommended usage life to the padding used so that it does not lose the weight absorption capability?
Okay, adding a padding, there are many ways. We can customize the adding padding, but of course we have to look at the patients and the wheelchair. What to add? It could be have to add at the abdomen. We have to add at the trunk area, through down to the hips. So that's why we have to look whether the adding is appropriate or not. So adding is something that it can be done, but we have to fabricate it. There's no adding ready-made. So that's why I said if you receive a wheelchair, the supplier should look at the patient sitting on it and look at the posture. Is the patient needs any additional padding or not? Yeah.
I have a question from our end here, Ms. Ruzina, because from iElder.Asia, we do sell several products that are typically used in the market to help pressure relief. For example, the Roho cushion, right? So you mentioned before that this padding varies from patient to patient depending on their needs.
Yes.
But would you say that the Roho or any, like, we have another product called the Treat Easy, which is basically a 4-layer piece of fabric. It functions
Yes.
like a seat cushion.
Yes.
So when it comes to products like these, right, are there any, say, risks involved in when I want to add extra padding or cushion to my wheelchair?
Yeah. Okay. Roho cushion is very famous all over the world, and we also do prescribe for Roho cushion to our patients, especially with tetraplegia and also with diplegia. The only problem is not the Roho cushion. A Roho cushion is fine because when you sit on the air cushion, of course, it will give you a comfort. So the Roho cushion, let's say, I don't know what you have. Is it a single Roho cushion or is a quadro Roho cushion? Because the quadro can also helps to correct their posture. But after sometimes, because of patients develop a lot of complication, that's why customized has to come in with the Roho cushion, still can be used, and we have to add an additional support for the patient. That's why we have to fabricate an additional foam for them. But there's no wrong using the Roho cushion at the same time. It doesn't give any problems to patients to use. Yes.
I see. So it's
Yeah.
not so much there's a risk, but rather in addition to these supports, we want to further optimize and give them the best support.
Yes.
Okay.
Yes.
Thank you very much, Puan Ruzina. One more question from one of our viewers on Zoom. Miss Nur Halinda Halimi says, hello panels. My question is to Puan Ruzina. I have 3 questions.
All right.
I am an architect studying accessibility in homes for ambulant children with cerebral palsy. Number 1, in your opinion, how is the level of public awareness regarding people with disabilities, particularly on wheelchairs?
Yes. All right. Okay, talking about awareness, I have to admit that our Malaysian are still not that really aware about this accessibility for wheelchair user, because we are not really like Australia, like US, but we are starting giving an awareness to our public. You can just look at our people in hospital setup. Which hospital that you think that is fully 100% accessible for our wheelchair user? Even in PPUM, even in UMMC, we still not yet 100% accessible for wheelchair. But my team has tried to communicate with our people in hospital level to provide a ramp, to give an input for wheelchair user to access to every of the building. So it's getting improving, but community, but just starting, you can see that our public bus is already providing for wheelchair user also, but it's very limited only in metropolitan area, but not from outside from KL. You rarely see this accessibility. And also we have trained also, train provide wheelchair user for them to access, but it's very limited. So we are far away from other country, of course, especially like Japan. So, but something need to be done from our people. Not just wheelchair user, but our governments, our public, everything should start thinking of how could they really getting involved or getting more access to what we like normal people can go. So I think that's it lah. But I have been talking about this, about accessibility wheelchair for so long already. I've been working for 30 years. That 30 years, I can see the improvement there is improvement, not to say no, but still far away. Yeah. Okay.
Okay. The second question that she has, what do you think about the accessibility in the built environment for wheelchair users? I would assume that, okay, the question as worded is, what do you think about the accessibility in the built environment for wheelchair users. Now, Ms. Nurhalinda, if you want to be more specific about this, you can type it out in chat. Otherwise, based off what I can understand from what I'm reading, is I would assume it's the current state of the built environment for wheelchair users, meaning the current accessibility options. What do you think about the current state of them?
All right. For current accessibility, it's very limited actually. Not to say widely can be accessed by our wheelchair user, but our wheelchair user is, I can give them congratulate because they really want to be part of our community. They want to be inclusive, so they try their best to use whatever accessibility that even though it's limited, like a shopping complex. But we can see that like parking area, they started already allocate wheelchair user or OKU people to park there. And you can see a toilet somewhere in Subang Parade that also for wheelchair user. So it is starting, but it's not every building providing that. So that's why we have to make like aggressive campaign, aggressive awareness about this. Yeah.
I want to slide in one question here of my own. Based on your experience, have you seen these kind of accessibility options in any other country in the world that you think is excellent, that we should strive to imitate or to learn from?
I haven't go any of country like what you say, but from my colleagues who went there in Japan, I think Japan is we can consider as not to say 100%, but almost 80 to 90%. They are accessible for their wheelchair user. That's what I can see. Yeah. But some where in Thailand, I've been there in Thailand, but I can see that basically the hospital that I visited, it is accessible for the wheelchair user, but not I haven't went to their mall or to their public facilities. But the hospital, basically the hospital, yes. So what I'm trying to express is actually we should start from the basic. If all hospitals are 100% accessible to wheelchair, I think that's great because most of our people will come to our hospital. So that would be very great if our hospital should give an accessible for our wheelchair user. Yeah.
Okay, I'm just going to go to our participants' final question. Number 3, my elder sister is CP quadriplegic with scoliosis who is wheelchair bound, fully dependent on a caregiver. And does your wheelchair service cover for some home visit consultation? She's looking for a new wheelchair for her.
All right. We have a service on that. But the thing is, as I said, UMMC needs a referral. So for the first visit, you need to have I will call this a record from our UMMC. So once you have the record and doctor has assessed, and we occupational therapists, of course, home visit is part of our role. So we are doing that. Yep.
I see. So for the first visit, she still has to come over and let you guys do the record.
Yes, we need to record. Yeah, we need to record. Yeah.
I see. Okay, Nurhalinda, Miss Nurhalinda, I hope that answers your questions. If you have further questions or follow-up questions, or if the rest of our attendees have any other questions, you can put it out in chat, be it Facebook or via Zoom, and we will address those during the Q&A session at the end of the presentation. Okay, so without further ado, Puan Ruzina.
Yes, all right. Okay, talking about appropriate wheelchair is something that something similar with to choose the right one. So this is a summary what I've been telling just now. So once we have decided to choose a wheelchair, we always have to think of, does the wheelchair meets the user needs? So the user needs means, just now I mentioned everything. What is their needs? Where do they want to go? Do they active or not active? All right, this is something that we need to think of. And where the environment are, where are they going to, is the right match for user, and then ensure that posture or support and maintain and prepare and repair locally, because no point having a wheelchair or very high tech, but finally when something happened to the wheelchair, we have to wait for people from overseas like US, like Australia, UK, to come and repair our wheelchair. All right. Okay, this is just to give you an idea. Look at this. When the wheelchair is too big, look at how does the patient sit, right? When it is too wide and seat is too deep, okay, you can look at that, right? Start leaning like this. And then footrest is too high. Look at that. The arm, the lower limb is not touching the seat, right? And the footrest is too low and the leg is not on the foot plate, so it's hanging. So this is all position that you choose wheelchair. Make sure that this is all fit, and the backrest is too high above the shoulder or above the head. So this is all inappropriate wheelchair that we should not choose, and we should consider, and we should try patient on the wheelchair so that we know which one is the best for them. No proper sitting cushion, just mentioned just now. Rear wheels set too far forward and backwards. The big wheels is too far at the back, so this will make that the wheelchair is, to propel the wheelchair is very hard, right? And the armrest is too high, right? And front and rear tires too thin for live outdoor. Yeah, too small and thin, so outdoor will not will be appropriate for the wheelchair user. So more effort will be needed once to use for outdoor. And then the parts couldn't be replaced because it is all from overseas. Okay. All right. Once we have choose needs, user needs, you always have to make sure that you are able to transfer patient, get in and out. All right, getting in and out is very important, from bed to wheelchair, from chair to chair, from anywhere, from car to chair, so that transfer is easier. So you must make sure that wheelchair is fit to do the transfer. Pushing the wheelchair is easier when the armrest and backrest are at the right height. So kalau height is not the right height, so you have problems in pushing the wheelchair, right? And folding the wheelchair is also important, whether it is a close folding, backrest folding, which is usually in our rigid wheelchair, okay? And also there's non-folder frame. We also have non-folder frame, all right? And cushion, you need to choose the cushion. And then carry out activities, wheelchair frame length, all right? If you look at the length here, this length is actually just to show you, is it wide base or long base, short base. So this is, sorry, this is a long base. This is a long base, all right? This is a short base, all right? A long base will give you more easier to move compared to this, right? So, and then you will have to look at the environment, whether the environment is rural area, even surface, uneven surface, rough surface, or something like that. And the tires. So you know the tires, the big wheel tires, there are two types of tires. It's a pneumatic or solid. So pneumatic is with air and solid is without air. But solids, there are so many types of solid tire that you can choose the one that really can provide better absorption. Pneumatics, the problem is you need to pump and sometimes easily get punctured. So you need to choose those tires which is the best accordingly to our users' needs or users' outdoor activities or indoor activities. All right, this is some of the examples that posture support device that I mentioned just now, the cushion support that we need to add, or could be the one that's already in the shelf, in the market. Yeah, they can have head support. They also have butterfly harness, but sometimes the one that we bought from the shelf sometimes doesn't fully fit with the patient. So we will fabricate another butterfly harness. All right, and supplier also can provide another butterfly harness. And backrest, this is the backrest that you need to be added if the previous, I mean, the current backrest does not really give a lot of support. All right, and this is the lateral pad. This lateral pad is actually to give a support at the trunk so that it doesn't lean to left or right. We are trying to put the patient sit upright. And this is the hard base seat, can be the cushion, yeah. And then the thigh pad, right? This is the thigh pad, the left and right while sitting. As I mentioned just now, if it is too wide, then we will add this thigh pad. And this, we also are looking for contour seat. This contour seat can be provided from the whole cushion, air cushion, or from the foam cushion. Okay, this is the relief cushion that we mentioned just now. There are 4 layers that need to be in the relief cushion. And if you look at this is the space that we give for our buttock, our bone, our IT bone, the sharp bone at during our sitting to relieve. There's no pressure there. That's why this is the mechanism relief cushion need to be given to the patient if they already develop pressure also. All right, this is some of the accessories that you might need to add while if you are choosing your wheelchair. Tabletop. Tabletop is very important and it's very useful for patients to use while sitting on the wheelchair, especially a patient with geriatric, because you can put their food, their drink, their whatever, handphone on the tabletop. So they can reach here and the hand is supported and they can just place both hand on the tabletop. I think this tabletop can be available in any of medical supplier. Right, this is a board. This is a stump board that we provide also for patients, especially patients amputees. Yeah, we have also geriatric with amputees that sitting with the knee bend. The amputation is below the knee, so they don't have support on that. So by choosing the wheelchair, the right wheelchair, they have a wheelchair with the stump board. There is a wheelchair that with the stump support. So that's why choosing is very important to choose a wheelchair. And foot strap. So if patients cannot maintain their foot on the our foot plate or our footrest, so we have to add this accessories foot strap so that the foot doesn't drop from the foot plate, and this will cause injury if they drop from the foot plate. And you always see that patients couldn't sustain their both leg on the footrest, so you need to add a foot strap. And foot support, this is something that more easier. Foot support is a one piece. I think this also can be available in our market. Right. Okay, we go on with the type of wheelchairs. All right, just to show you, this wheelchair designs has been started 525 before century already. So people already thinking how to mobile from one place to another place. So until today, you can see this is a very advanced robotic where people so high-tech with this. So this is a robot, and then they can just move wherever on the stairs. They can move on the stairs, downstairs, upstairs, on the ramp, so on the rough area. So this is very advanced, yeah. Okay, this is some of the basic parts that all of us has to know. I think as a user, I'm sure you already know this is a push handle, this is the armrest, this is the push ring, all right? And then the brake, rear wheel. This is at the back, the anti-tip for you to tilt the wheelchair, especially when you want to move to obstacle. Okay, this is casters, the small wheel that I mentioned just now. And this is a cuff strap, foot plate, and then the frame, the whole frame, and this is the seat and the cushion. All right. Okay, for motorized, all are the same, except you have this joystick and you have this control, integral controller to forward, backwards, all right, left and right. And you also have signal, and then you also have, we call this lights. There are so many types of motorized wheelchair in the market. All right, this is a very famous and very widely used transport wheelchair, especially for the elderly. They like to use this because this is very light. But there are limitations with this because you are totally dependent on the caretaker to push wherever you want to go. All right, and it's very, very light and easy. But it depends on the wheelchair, the wheelchair user. If they really need this, they can have it. Yeah. This is a standard wheelchair manual. Yeah. This is very standard, and you can see everywhere in our hospital. Yeah. Yeah. In our clinics, it is very standard and it's very heavy. But this can be pushed by the the user can push themselves or the caregiver, right? All right, this is lightweight. So talking about lightweight, there are so many types of lightweight wheelchair. So to talk about lightweight, the weight has to be like more than, how to call that? 11 kg to 15 kg. The whole weight, yeah? That is lightweight, but still it's not light to me because it's like if you use every day, or the caretaker has to carry the wheelchair and to keep the wheelchair and to bring the wheelchair on the car. So it's still heavy if it is heavily used, yeah, but it's considered a lightweight wheelchair. All right. Uh-oh. Okay, what's happening? Hold on. All right. Oh, stop. Sorry. All right. This is a custom-made wheelchair. All right. I'm not sure whether iElder has this custom-made wheelchair. Custom-made means we have to measure. We measure the width, the length, everything, and we order to the manufacturer. So this usually product is very expensive, but some patients really wants to buy the custom-made wheelchair. All right. So everything we will what call that measure. All right. This is pediatric, where everybody knows about this. All right. And then recliner wheelchair, very commonly used. Right. And heavy duty wheelchair is for obesity with people more than 200 kg, 100 to 200 kg, and you also have 300 kg. This is a sports wheelchair who, if the wheelchair user wants to involve in sports, and motorized wheelchair, as I mentioned just now. And this is also famous foldable motor wheelchair, where you can fold and you can carry. It is more lighter. And this is a rough rider wheelchair that we mentioned that need to be used if you are in an area that uneven surfaces. And we have standing wheelchair, right? And this is also wheelchair. It's a shower commode wheelchair where patients can propel and go to the toilet and bathe. This is street and space wheelchair. This is good to maintain their posture in 90 degrees, 90. All right. We are going to the end of the session. So what are the question needs to be considered? So how long do we use for, how long do we want to use wheelchair? How much support that we need? And you have to consider, can you push your wheelchair independently? And then either you want recline or upright design. What is your body size, shapes, and height? And how do you fit a wheelchair from measurements? And are you at risk of pressure ulcer or skin breakdown? And what wheelchair accessories do you need? So this is all you need to identify. And what are the features that you need to look for? So of course you need to look for the seats. Okay, most wheelchair is made from nylon or vinyl. So you need to choose the material, the size of the seat, the height of the seat, the chair, the height of the wheelchair, and then the armrest, the leg rest, the wheel, the type of tires, and the wheelchair frame. Because wheelchair frame we have like steel frame, we have titanium, we have also carbon wheelchair. So this is all the things that you can look and you can find in the market. You can ask the best for our client or our family members. Right, that's all about wheelchair. Yeah, thank you.
Thank you very much, Puan Ruzina.
Yeah.
Okay, just give me 1 second. All right, there we go. Okay, so we do have a few more questions coming in,
Yep.
but before we move to the questions, I want to give another thank you to Puan Ruzina for the very informative session and the
Yes.
coaching on what to look out for and what kinds of wheelchairs there are. And more importantly, I think the takeaway for today is that there are many different types, and if you're not sure, you can always approach for consultation. That is the most
Yes.
sure way to figure out what type of wheelchair you need. Otherwise, just by starting with identifying the difficulties that your patient is going through, you can already start to look at what kind of wheelchairs can sort of tackle your needs.
Yeah,
Okay,
yeah.
I'm going to jump right into the questions. This is coming from Miss Karina Lai from Zoom. She asks, how do I choose a wheelchair for male and female? Because the wheelchair we bought for my mom seems small for my dad, and it's harder to push him around because he's heavier. I think I'll open this up to either Puan Ruzina and Dr. Kong. If you have any thoughts, you can come in and answer.
Maybe Dr. Kong want to comment something about it? All right. Huh? Oh, me. Okay. Let me say something about. Actually, there's no wheelchair for female and male. Right? There's no wheelchair for female and male except the colors. You can choose the pink colors, which is suit to maybe for female. But there's no female or male because, as I said just now, you always look at their needs, their problems. Maybe because of behavior, that's why we want to know whether the mom or the dad is been using the wheelchair for how many long already. The wheelchair, fully maintained. Is there any problems with the wheel, the small caster? That's why you feel that it's very hard, it's very heavy. In terms of weight, the mom and the dad, or how much is the weight? Because even though our patients or our family members can be heavier, but if we choose the right wheelchair, of course, it doesn't give you a lot of problems pushing as a caretaker, right? So looking at the comment by our client just now, I don't know. I suppose the wheelchair is not well maintained. I suppose, or maybe can she say something about this? I don't know. But to me, is there's no right for female or male. There's no wheelchair for female and there's no wheelchair for male except the colors. Yeah.
There's no gender discrimination when it comes
yes.
to wheelchairs.
Unless you choose the colors lah.
Yeah. Okay. on our iElder side, since we do carry different kinds of wheelchairs, we have noticed that certain designs or certain brands of wheelchairs are designed to be easier to push. For example, our Kawamura series, when compared to the regular wheelchair used in hospitals, the frame itself uses a different kind of metal, and the wheels also are made. I think like they have better mechanisms inside, and then the PU tires makes it very easy to push, but it also comes at a higher cost. So if you are able to, I would suggest, even if you cannot, if you have difficulty bringing your patient to go and test out a wheelchair, I would recommend you to take the place of the patient and sit in the wheelchair yourself, or have someone with you sit in the wheelchair and then take the place of the caretaker and then push them around yourself, because this gives you a better idea of what the caretaker will experience or what the patient will experience.
Yes. You need to test it.
Yes. So Miss Karina, to answer your question in a nutshell, there is no difference between a male or female wheelchair. But if you are looking for something that's easier to push, yes, because the weight of the patient definitely does play a factor, and but you have to bear in mind that the weight of the wheelchair has a very important role as well.
Yeah.
Okay. Okay, next question coming in from Mr. Shiva Sagaram. I think it's the same Mr. Shiva from Facebook. He asks, is there a lifespan to the Oka cooling cushion? My parents are using that now. Okay, so I'll answer this question because we do carry the Oka cooling cushion in our catalog. The Oka cooling cushion itself, wear and tear is meant to last for a very long time. In fact, if you don't slash the material, if there's no slashing damage on the material, all you have to do if you feel like it's no longer firm is you can pull up the valve, just open up and fill it in with a little bit more water, depending on how thick you want the cushion to be. So if you have a more specific question, or if you have a specific situation, you can always just take a picture and send us a WhatsApp, and we will be able to advise you further. Yeah, Mr. Shiva? Okay. So that was for the Oka cooling cushion. I have another question here. For, I think this is PAEDS. I think this is...
It's a pediatric.
Pediatrics. For pediatrics,
yes.
Parents mostly consider if the wheelchair can be easily transferred to or from vehicles. How do therapists go about this?
Yes, of course. Not just the pediatric. I think everybody wants to have a wheelchair that's easier to be transferred to the car. All right. This is a very important issues that we should address. But as we say, is that we have a lot of design in the market. The more that the design to be more easier, the price will be raised up. So we also know that there's a design that you can fold the frame and you can detach the armrest and footrest and the wheel and the big wheel and the armrest and footrest. That is the basic that I think everybody thinks that is easier. Because to me, some of our caretaker, they rarely detach the footrest, detach the wheel, the big wheel. So they usually carry the whole wheelchair and put in the car, which is very difficult and it's heavier. That's why if you choose some wheelchair, especially pediatric, the one that can be detachable, the armrest, the footrest, and the wheel, and the frame can be foldable. I think that's the basic that I think you should choose that. We have also in the market that smaller than that. You can detach everything, and it's very small. The frame can be also be detached. So there's a lot of detach, but sometimes too much detached, you having a problem to attach. You see, is because that's why to me, the basic, if the wheelchair can be detached, the armrest, footrest, and you can fold, that will be fine already. I think that is the best, easily transfer to the vehicles. Yeah.
Okay, thank you very much, Puan Ruzina. Over here, we do have several different types as well. As Puan Ruzina mentioned, the most convenient one would probably be the wheelchairs with the detachable armrest, footrest, because then with this modular feature, you can easily just pack it up and separate it, break it up into smaller pieces. The only difficult part is that you have to understand where each piece goes and how to reassemble it.
Yep.
Although
Yep.
it is not difficult. In fact, a lot of the designs nowadays are very, very simple and easy to use. Yeah.
Yep.
So do spend a little bit of time with your supplier and make sure that you learn how to put it together, because once you learn once, it's very easy to put it back. The weight. Okay, so this is from Rafida Ahmad in just a follow-up. Says that the weight of the wheelchair is also a concern, and whether or not we have pediatric sizes. With regards to the size of the wheelchair, for us, mostly it's if you have a certain model, the only difference would be the seat size. Yeah, but there are also like in Puan Ruzina's slides earlier, you have many different types of wheelchairs, including the travel-sized ones.
Yeah.
But more importantly, is that you have to make sure that the wheelchair does take care of the other needs of your patient. Like, let's say if you need the back support takes priority first and foremost. Otherwise, I believe Puan Ruzina also showed that she has many different types of accessories and attachments.
Yes.
So if you ever need to go for further consultation, you can approach Puan Ruzina. I believe that's under the services of MOTA, right?
UMMC.
UMMC, yeah. So do approach Puan Rafida's team in UMMC, and she will be able to help you out.
Yeah.
Okay, we are running a little bit over time, so I'm going to open up the floor for maybe 2 minutes for last minute questions. Otherwise, we'll just go to the end of today's webinar. But before that, Puan Ruzina, do you have any maybe case studies for some of our caretakers here who have issues whenever they want to take care of their patients? Because we have a lot of complaints, or we have a lot of people coming in and tell us that regardless of how well they try to take care of their patients, eventually they have a problem where they just start to slide down the wheelchair.
Yeah, I think this is commonly in elderly. So I think what we have to do is, of course, you have to choose the right wheelchair, which has to be comfortable. And another thing, you might add an accessories for hips belt. So the hip belts is actually to maintain the hips in 90 degrees so that it doesn't go slouching. So I think that will help to prevent the patients slouching or slide down. Yeah.
Is there any, like, let's say if they want to approach you for UMMC for consultation, what would be the best way to approach UMMC? Email or call or?
Email by call. By call.
Calling. So the phone number is on the website. Huh?
Yep.
Okay.
Just call me. I will try to give as many as information that we can to help our patients. Yeah.
Sure. Thank you. Okay. I think we have one last question from a Mr. Hong Huai Chin. Hi, do we have any criteria to determine the height of the armrest?
All right. The criteria I just mentioned just now, we have to look at the patient's activities. If the patient is very active, all right, they wanted to be active, they can be active. So the height of the backrest should be slightly below from the armpit, right? So if the patient needs more support, so they can't sit without better support. So you have to choose somewhere near to the shoulder. And if the patients need extra support of the head, so of course you need the support of the head support to be added. So that's why you have to assess the patient's need first, whether they are active or non-active, how long they can sit on the wheelchair. So the best, another one is if super active, the backrest is actually below of the scapula. So the end of the scapula is at the back, so below of your scapula. So that will be the best for the patient who are totally active. So we have variety of backrest height actually. Yeah.
Okay. I hope that answers the question, Mr. Hong. Unfortunately, we have come to the end. We have come to the end of today's webinar. We are running out of time. But thank you so much, Puan Ruzina. Thank you, Dr. Kong, for your time here today. For the attendees, if you have any other questions for these two, you can look them up. Their contact numbers are available on UMMC website and iElder.Asia respectively. So, okay, so now we're at the end of the webinar. Thank you all so much for staying until the end. As you mentioned before in the beginning, there is a free ebook courtesy of UMMC that you guys can get. All you have to do is fill in the feedback form, which I'll share now. Okay, there you go. So if you can just scan the QR code that's on your screen at the moment, you can fill in the feedback form. Once you fill that in, there'll be a link for you to access and download the free ebook. Once you've filled up the feedback form, your entry will all automatically be entered for our giveaway. That's the Master Quick Touch hair color, courtesy of iElder.Asia. So if you are looking for wheelchairs or consultations on wheelchairs, you can always just come to iElder.Asia, give us a call, or visit our website, take a look at all the wheelchairs available. If you want to view these wheelchairs in our showroom, we are located in Cheras, Perdana. All you have to do is give us a call and let us know which one you want to view, and we'll get it into our showroom for you to view. If you need wheelchair consultation services for your loved ones, for their patients, do contact Puan Ruzina once again through the UMMC contact number, and you'll be able to give you a consultation. Once again, thank you guys so much for attending today, and we will see you guys during the next webinar, hopefully. Thank you so much, our panelists, Puan Ruzina and Dr. Kong.
All right, thank you. Have a nice day. Thank you. Bye.
Bye.
Bye, everyone.